From beginning.
From the beginning.
All right, I'm Tom Gentleman. I'm an ear nurse. I'm going to talk about coronary heart disease and acute coronary syndrome, which is blockage in your heart and having a heart attack, pretty much. Plaque is the primary cause, and it's usually when one of these plaques rupture that we have an acute event. Prevalence and incidence: 6% of the population is affected. 20% of those aged 65 and above are affected. There are nearly 400,000 deaths a year from coronary heart disease, almost 1 million heart attacks, and over 600,000 of those having a heart attack are a rookie at it, so they need a lot of help. It's a multidisciplinary approach. There's a lot of people involved. This is not an exhaustive list, but it's a lot of the people who might be in it: nurses, doctors, social services, dietitians, pharmacists, psychologists, counselors, EMS, financial people, PT, OT, RT, hypnotherapy, cardiac rehab, exercise physiologists. There's a lot of people involved, and they're all involved at different stages of the process of the management of the disease in the event. Goals right off the bat. I added a little pre-emergent category. You want people to recognize what's happening, how to prepare for it. One of the main things is you make sure you've got AEDs and airway support tools in place. We're talking about doctors' offices, clinics, places where people are just finding out that they have coronary heart disease. There's not necessarily an acute event happening yet. Education: at this point we're talking about education of the patient who's not having an event, and also education of the staff. It's really important that they get involved. Emergent, of course, that's EMS. You're coming to the emergency room. There's standard clinical pathways involved. You educate the patient about what's happening now, and again, mainly education is for the patients. Guidelines are developed to get these people together, so respiratory's there, your support people are there, the doctors, anesthesia if you need it, whoever you might need. You make all these plans. You manage the outcome. How do you determine your outcome? You look at every case. Sometimes you can do grand rounds. Sometimes you can do video. Intensive care, it stays pretty much the same as you move into the intensive care. People go to the cath lab, they get surgery, they get medical management, but mostly you're looking at treating the patient, and you manage you evaluate the outcome by how well they do. In the acute phase, you maintain their stability, and then now you're getting dietary, pharmacy, rehab. You're getting your discharge planning involved right off the bat. You can get some specific evidence-based practice discipline guidelines into place here. Ways to follow up how you're doing here is at the time after discharge you can do follow-up surveys. Rehab, the big challenge is to get people enrolled in rehab. Your goals are to improve the overall outcome. And again, you have your multidisciplinary approach. At this point, you're adding more of the PT, OT, that sort of thing. You're getting everybody involved who needs to be involved. Stress is a huge deal. As was mentioned earlier, depression with these events can be an enormous deal, so you get psych and counselors involved. And you evaluate that. You can evaluate physical capacity, strength, stamina, progress, and then how well people adhere to the regimen and the programs that they've gotten involved in. In the end, home care, you want your patient to achieve their maximum potential for health. All those education things are still in process. You want to have special procedures involved. And people talked about meetings earlier. If you've got processes involved, then you can use those. How do you evaluate this? You maintain contact, and you monitor the adherence to the previous and newly developed healthy lifestyle behaviors that you've tried to talk about. A couple of the things that I would like to add, especially in that late section, is smoking cessation, weight loss, commitment to exercise, and avoidance of risky lifestyle choices. And I found a couple of organizations who I thought would be very well suited to help with the using more hypnotherapy to attain these goals, especially since that's probably not covered in a lot of cases. And the other one, since I love to eat, more dietary education and arranging actual dinners and cooking demonstrations and participating type things for families and the patients to learn that it doesn't have to taste like cardboard if you're eating good. And here's some sources, potential sources for funding for that. Thank you very much.